So today we're taking a look at this gentleman pulling a knife out of his forearm with his teeth, which is pretty crazy. Now we've talked before about knives, we talked about scalpels and how those are used and how there's a prolonged recovery time due to that because the tissue has to heal. But we haven't quite talked about what would happen if you were pierced straight through your forearm with a knife or a blunt object. And the physical therapy that you would likely need would be dependent on if you had surgery or not. If you had surgery, it's going to be based on whatever the precautions and the protocols of that orthopedic surgeon are, which is something that physical therapists and surgeons have to work on together. So once he's been cleared by ortho post-surgery for us to start doing our interventions, we'd be looking at range of motion, trying to make sure his wrist flexion, wrist extension, ulnar deviation, radial deviation, supination, and pronation are all within limits as compared to the other side. And then after this, we'd be taking a look at strengthening all of those forearm muscles to make sure that they're going to be equal or at least as close to equal bilaterally as possible. But at the end of the day, he is way better off than this guy who's going to need a lot of physical therapy.